There should be a new. Please, guys, if you can see me on Facebook Live, please let me know. Let me check my phone. Okay, guys, as I said, this session is very important session, and every single question here, really very important. If you miss one question, I believe in this case, you may feel that you really need to know the answer of this question. Because this actually the most important, I would say the most important questions you must know about them are most important topics and concepts with critical thinking, definitely. Okay, guys, before I start, I would love to check in on every one of you and see if I'm live or not. Please, guys, if I'm live, please let me know. By the way, guys, let me explain a little bit about, let me check now where I am. Okay. So, guys, I know exam is very soon, and you really, I would say, we all under a little bit of pressure at this stage. But how we feel right now, guys? Please admit if you can admit the candidate on Zoom, because there are lots of candidates today on Zoom. And please, our champion, if you are in Zoom, can please admin send the link to our champion Zoom. They can join the Facebook group, Facebook page. Okay, guys, this session is one of the most important session, as everyone have heard before from our champions. They usually say the most important thing in Dr. Beto's course is the last few weeks before the exam. Why this? Because I always have a plan in my mind to get all the most confusing questions and the most important concept to discuss with you at that time. And more things, actually, I keep it for myself. So please, guys, everyone should pay attention for today's session. You shouldn't actually miss any information we're gonna discuss right now, because it really going to help every one of you. An exam is just only after a few days, after 8, 9 days. I believe you will hear my voice after 8, 9 days a lot in the exam, a lot. Today will be, as I told you, I actually thought about what could be the best way. We really went through lots and lots of things together. Lots. For the last 6 months, we covered lots. Concepts, questions, easy notes, but delicious, but bites, mock exams, lots of mock exams, like lots. And now we're thinking exam is just only after 8 days or 9 days. What should I do? I've been searching here and there. I found the best way is a technique called on-spot technique. On-spot technique, that's what we do right now. We're gonna discuss mock question, mock exams, and then you're gonna provide the answers immediately. And then at the end, guys, we're gonna count how many questions you got right and how many questions you got and right. Why this technique is very important? Because this is going somehow to put you under pressure similar to the exam pressure. We're gonna give you only max 30 seconds because exam, if you think about it, there are 70 questions in 2 hours, means mostly you're gonna spend 1 hour and few 1 minute and a few seconds or some seconds for every questions. This is even to give a little bit of time to revise, like 5 minutes, 10 minutes to revise. So that's only what can you get. So max is 1 minute for every question. So you cannot think that much in exam. So that's exactly what we gotta do right now. If you score in this exam, in this mock exam, if you're going to score 65% or 70% of all the questions I have prepared for you, means now you really have very, very, very high possibility to pass the exam as well. The last the last exam, the final exam. Okay, before guys I start, I just would like to check this first. First, Facebook. Just home. That's a one. Now I can see your comments. Okay. May I share the screen? Guys, can you please tell me, did you read the Delicious, guys? Guys, did you guys read the Delicious? So we're gonna make one day. So guys, the plan right now is, the plan is to start now with the most important revision part with the questions we've been discussed before, but still has a little bit of doubt. How guys did you find Bit Delicious with guys? Very good. Making your very delicious and very happy. Making guys your life easy. Okay. So please guys, every single word. Bit Delicious is one line. Every single point, just one line. One question with one answer. One question with one answer. That's it. So in this case, I would like, because the plan right now is we're going to discuss every day as I promised you. Now, I'm going to be with you every night. Every night start from 7, 7:30. I will be with you for the next 8 days, 9 days under the exam time to ensure that have we revised everything, but I feel like I don't want to leave you. I want to ensure I'm next to you all the time, right? And then, and that's why, guys, and that's why we all need to work hard, but without any pressure, any stress at all. Okay, great. Did you like the temperament Deborah diseases, doctor? All good? Okay, guys, I'm very happy to hear this. Now, the question we got discussed today at the end are going to be very important question toward the end as well, because mostly about extraction and things. Infection control, we're gonna cover in separate day. So guys, have you read the Bidobites infection control? I'm working also on Delicious infection control. If you have read Bidobites infection control, we're gonna have a separate day, the whole day, only for infection control, to cover all the most important concept, questions, topics in infection control, doubts. That's why I want to give you more time. I'm very happy, guys. I'm very happy to see this. You are my champions. You are the leader always, and you always going to be the leaders. Okay, let's start right now. Ready? I know, guys, most of you are fasting right now. I see most of you fasting, but let's start. I know you're tired, but let's start and see how we're gonna go. Guys, do you have your own pen and paper? I'm very happy to see you back again, guys. Pen and paper, guys, ready? Let me just get this. And this is the one here. Share. Please, our champion Zoom, if you really want. To comment or to answer, please be on Facebook page. Okay, guys, deep breath and let's start. Please, admin, there are champions still on Zoom waiting for approval. So please ensure. Okay, I will run 30 seconds, 30 seconds in my phone every time. You know what? To be fair, I will give you 45 seconds for every question. Guys, which one do you want? 45 or 30 or 1 minute for every question? If it's 1 minute for every question, in 70 questions, it means like you're going to have like 70 minutes, which is going to be 1 hour and 10 minutes. How long, guys, do you want? 30 seconds? 30, okay, 30 seconds. Very good. I'm happy with this. Okay, I'm happy. 30 seconds. As long as you say 30 seconds, I'm happy. Let's start right now. The first question, guys. I will give you 1 minute for this question because you may need to read the scenario. You're going to be tired after this session, after the smoke, but you will get a great benefit out of it. Let me check your answer. See, Charlie? Okay, very good. So let me check this. Question 1. What is the most effective initial school-based engagement resources of this age group? See, Charlie, I like it. Interactive practice demonstration, type of dance model with student participation. Thank you. We done? Another. Second question, please. Question 2. The previous febrile episode with widespread painful oral ulcer is most consistent with what? Which lesion? Look at his age group. Look at widespread ulcers all around, very painful, sore mouth. And this is the photo. Look at the photo. Cold sore. Let me check your answer now. I see the answer is C. I'm very happy with this answer. C, which is herpetic gingival stomatitis. Very good. Question 3. Which clinical feature would differentiate necrotizing gingivitis from the current diagnosis? Now, which feature will you find it in necrotizing gingivitis, but you will not find it in herpetic gingival stomatitis? Not a classical feature. Let me see your answer. Which one, guys, had... Okay, I will not give you answer until I see. D delta, A alpha. Okay. Now, there is a little bit of confusion here between D and C. And B. Okay, guys, let's do it together right now. Think about it. As long as we have confusion, I'm happy to explain more. But please mark yourself, okay? If you got it right, just keep it as right. If you got it wrong, just write it as wrong. Now, which clinical feature would differentiate necrotizing gingivitis from the current diagnosis? Now, necrotizing gingivitis. Do you think necrotizing gingivitis has gray pseudomembrane? What do you think? Guys, am I still alive on the Facebook? Yes, okay, very good. So, gray pseudomembrane, actually, it can find in necrotizing gingivitis. Do you think can be found in... Let me just do this one here. Please, admin, we have champions waiting on the Zoom, please. Now, gray pseudomembrane, does it exist in necrotizing gingivitis? Yes. Does it exist in herpetic gingival stomatitis? Do you think in or on herpetic gingival stomatitis can be pseudo gray pseudomembrane? There's a few things. Spontaneous bleeding. Do you think the gums in necrotizing gingivitis definitely will be spontaneous bleeding? And in herpetic gingival stomatitis, do you think we have spontaneous bleeding? Spontaneous means without touch, like bleeding on. Do you think herpetic gingival stomatitis, the gums will bleeding on? Now, we are more toward spontaneous bleeding. Fever. Yes, both of them can have fever. It's easy. Punched out papilla. Punched out papilla It can happen in necrotizing gingivitis, but not necessary to happen in herpetic gingival stomatitis. Suppuration can happen in necrotizing gingivitis, but not in herpetic gingival stomatitis. Now, we understand this. In MCQs, you may get 2 to 3 options correct, but one of them is the most characteristic. Now, which option of these can be found in necrotizing gingivitis? Which one of these guys? Spontaneous bleeding, punched out papilla, suppuration. Which one of these? Which one the most characteristic? In order. I need them in order, guys. Tell you something? The most characteristic is a spontaneous bleeding, then punched out papilla, then suppuration, then gray pseudomembrane, then fever. Dr. Melzman, everyone, guys, you mentioned. The other question was the way around. Guys, please, guys, hear what I'm saying. Please don't mag up questions and answers. Because if I reverse this question and then say which it can be existing in herpetic gingival stomatitis, not necrotizing gingivitis, right? In this case, the answer is fever. So please, guys, be careful because this is other type of questions. So if you're going to answer fever in this case, means you messed up a little bit of questions together. Am I guys clear about this part right now? The question asked about necrotizing gingivitis, not about herpetic gingival stomatitis, because that's true. Okay? Okay, question 4. 30 seconds for question 4, please. If the impacted dilacerated incisor is left unmanaged, what is the significant risk? Is a spontaneous correction, root resorption of adjacent teeth, reduced caries risk, fluorosis, gingiva recession only? Guys, I know, guys. Okay, time's up for this question. The answer is B, bravo. Root resorption of adjacent teeth. I know. Now I love this situation right now because in this situation, as you see, you really be in rush. I give you more time by talking. Sometimes we exceed 1 minute, like in exam, but the clinical thinking is important as it has happened in this question. Answer, guys, for question 4. B, bravo, root resorption of adjacent teeth. Question 5. Yes, are you a magician? That's true. Because how come spontaneous things can happen and so on? Question 5, I already got 30 seconds. When determining whether to extract or orthodontically extrude the dilacerated incisor, what is the most critical factor? Is a child or patient age, or the space available to take the tooth out from or to do ortho? Time's up, guys, for this question. Let me check what is your answer. Your answer is, or the answer to this question is C, Charlie. Degree and direction of root dilaceraton. The answer of this question is degree and direction of root dilaceraton. C, Charlie. Next scenario, I'm going to give you about a minute to read the scenario and the questions together. Let me set up a minute for you. A minute and 30 seconds, to be fair. Now, guys, there is a minute and 30 seconds to read the scenario and also to answer the question. All the champions in Zoom, because I see we have a lot on Zoom still there. Please ensure you are on Facebook. Okay, only a few seconds left. Now, the question is, given generalized gingival enlargement with visible plaque and inflammation in patient taking this anticonvulsant medicine, what is the most likely explanation for inflammation? I see some of you guys answer C, Charlie, and A, alpha, and B, bravo. A, alpha, D, delta, C, Charlie, A, alpha, D, delta, A, alpha, A, alpha. Okay, guys, a surprise, and this is actually what happens in the exam. What's happening in exam is your brain, it just has one way of thinking, not multiple ways. So the answer you used to answer all the time for the question, that's the answer, you're gonna choose it. Please, guys, be honest yourself, because I have seen most of you answered the question which is not right. Look, guys, the answer is B, bravo. Plaque-induced gingivitis. So if you have answered the A, be fair to yourself, be honest to yourself, and keep A as the right answer to calculate. If you look at this question, that's what happened in exam. So that's why I made this is for you. And that's why the candidate came out from exam and say why I couldn't pass. Because reading the question, something very important. Definitely looking at this photo straight away comes in your head. It is drug-induced gingivitis, or sorry, enlargement. Gingival enlargement. But look at the question. Given generalized gingival enlargement with visible plaque here and there, and inflammation, redness here, redness there, redness here, sloughing redness here. And the patient taking the carbamazepine. What is the most likely explanation for what? The key word, inflammation. Medicine, drug-induced gingival enlargement, which is a medicine, doesn't result in inflammation, but result in granulation. But the inflammation will be because of plaque-induced gingivitis. Be bravo. Okay, go practice. Question 2. 30 seconds this time. Tricky, right? Yes, Dr. Fatima, you're totally right. It's really tricky. Only 7 seconds left. Consider the medication and clinical finding, which mechanism most possibly explain the generalized gingival enlargement. Easy now. This one easy. Answer is B, bravo. Drug-induced gingival enlargement. Very good. Question 3, 30 seconds. For extraction of tooth 2-5, which force application is most appropriate? Buccal and palatal force strong toward the palatal. Buccal and palatal forces strong toward the buccal. Rotational forces, figure A forces, meso and distal forces. Time's up. The answer is B, bravo. Buccal and the palatal. By the way, guys, the last two scenarios will be mainly for extraction, which is really, really very important. Buccal and palatal forces stronger toward the buccal because the buccal bone are thinner than the palatal bone. Be bravo. Question 4. Which intraoperative measure best reduces seizure related injury risk during the procedure? Avoid suction air water syringe use. Confirm anti-epileptic medication compliance and use a mouth prop. Perform without look anesthetic. Which one? Time's up. Answer is B, bravo. Easy question. Question 5. The patient develops bilateral convulsive movement with loss of consciousness. You diagnosed the case as neurological condition. What is the most appropriate immediate action? Place the patient upright and reassure. Stop treatment and turn the patient onto their side. Insert mouth probe between teeth to protect the tongue. Restrain the lips to prevent injuries. Give aspirin to reduce neurological complications. Answer, guys, is B, bravo. Stop treatment and turn the patient onto their side. Question 6. During the dental procedure, the patient develops generalized tonic-clonic movement. The patient episode settles spontaneously. Several times, several minutes later, a second convulsive episode begins without the patient regaining full awareness. What is the right answer here? At what point this presentation initiates immediate activation of emergency medical services? The answer is C, Charlie. When convulsive activity persists beyond 5 minutes or recurs without recovery in between. The answer, guys, B, C, Charlie. I give you a minute for this question. A 70-year-old woman attends for extraction of tooth 1-6. She has hypertension. During local anesthetic administration, she develops slurred speech and unilateral facial weakness. She remains conscious. There is no generalized motor activity. The operator is right-handed. So all the champions Zoom, I see up to 200 candidates in Zoom. Please, if you can move. If you want to ask question, you can move to the Facebook page. Question 1. Which feature in this presentation most strongly suggests stroke rather than seizure? Seizure different than stroke. Stroke, it means like something happened with blood vessel. Patient will have facial weakness and slurred speech. Definitely, guys, be bravo. Question 2. Start again. What is the most appropriate first action in this case? Place the patient upright. Patient has a stroke right now, stroke. Stop treatment. Administer aspirin. Continue to finish extraction quickly. Give all fluids. Definitely the most appropriate treatment is the first action, is to stop treatment. That is the first thing you must do. Stop treatment. Question 3. After stopping treatment, what is the most appropriate next action? Patient, you suspect patient has a stroke. Is it call 000 or provide aspirin immediately or lay supine with legs elevated? Very good. We showed that. Time's up. We should call 000 first, right? Which is B, bravo. Question 4. While awaiting ambulance, which approach is most appropriate if the patient remains conscious? Guys, the key word is patient is conscious. Upright positioning or lateral recovery position or prone positioning with monitoring? Which one of these? Guys, every single information we discuss is right now really, very important. Every piece, tiny piece of information, really very important. Please write it down. Answer, guys, is A, alpha. I see most of you answered B, bravo. Please, if you have answered B, bravo, record in your notes, because patient is conscious. And if the patient is conscious, in this case, I will put the patient upright position. You see, guys, from where the trick question coming? Guys, a trick question coming from here. The things really making hard in exam are these type of questions, or these types of questions. Okay, next question. Question 5. Why should aspirin be withheld at this stage? There's a big reason. And by the way, aspirin, you see, guys, this type of question will be confusing. Time's up, guys. The answer is B, bravo. It may worsen intracranial bleeding if hemorrhagic shock, because the stroke can be hemorrhagic shock. Do you know which condition, if we suspect it, we can provide aspirin? If we say, guys, would be great. I'll be very happy for this. Let me check your answer. I'm always proud of you. Thank you very much. Angina. I love this. I love, guys, that you got into the stage after a long time. It was hard, guys, to understand about all this information, right? Think about, guys, yourself in the beginning of the preparation of the exam and now. Completely different. And I'm very proud of you. This type of formation took us a little bit of time to get a hold in it, right? I'm very proud of you guys. You're doing great. You're always the leader. Our champions, always the leader. Very good. Next question. Question 6. Again, 30 seconds. But sometimes I give you 45 seconds, by the way. For the right-handed operator, what is the most ergonomic position to extract tooth 1-6? Right-handed. Is that front, back, sidewise? Time's up. Because tooth number 1-6. So in this case, it will be right and front the patient, A alpha. We're going to discuss the rest of the position at the end. I have two scenarios mainly for this. Okay, 1 minute and 30 seconds for no, 1 minute only for this question. Be careful, guys. This type of question, they're really tricky. A 60-year-old man treated with dose-related head and neck radiotherapy. Low saliva, receiving anti-resorptive therapy for osteonecrosis. Which factor is the most significant contributor to the patient carrier susceptibility? High sugar intake, dose radiotherapy, anti-resorptive therapy, gingival enlargement, or paroxysm? Let me check your answer. B bravo, I'm very happy. Yes? The answer is B bravo. Question 2. Which additional factor contributes to ongoing carrier susceptibility? Which additional factor contributes to ongoing carrier susceptibility? The answer is B bravo. Altered salivary buffering. Question 3. 30 seconds. What is the most effective home-based preventive measure in the context? Fluoride vanish, daily 5,000 ppm fluoride, chloroxidine, saliva substitutes, and then stop carbohydrate. The answer is B bravo, and E equals wrong because we can stop carbohydrate, the patient will die. And fluoride vanish, it can be good, but this is not a home-based preventive measure. Question 4. 30 seconds again. Guys, I'm teaching you in the hardest situation to make the exam for you as a fun. Imagine right now, guys, with this pressure, we are quick. How the exam will be then? I think your time management will be perfect. And the pressure will be less. Definitely, guys, A alpha, saliva substitutes. Question 5. 30 seconds again. Given the patient medical history before extraction, which complicates as a primary concern to radiotherapy? Answer is A alpha, medication-related osteonecrosis of the jaw. Question 6. Which operative principle best reduces the risk of compromised healing? Traumatic technique to shorten time, a traumatic technique and primary closure where possible, a traumatic technique and secondary closure where it's possible. Time's up. Answer is C. Answer is B bravo, a traumatic technique and the primary, not secondary. Next scenario, a minute. "50-year-old medically fit woman requires extraction of tooth 35 and 36 due to gross caries. A separate appointment is planned for 227. The operator is left-handed during consent. She reports a previous seizure many years ago, but no current diagnosis." By the way, guys, please be delicious. Very, very, very important. Now, which force application is most appropriate for extraction? For extracting tooth number 35. A, B, or C, or D? I see answer between A and C. Time's up. Answer is C, Charlie. Buccal and lingual force is stronger toward the buccal. We have mentioned multiple times before. We have mentioned multiple times before. That rotation only will not be good because it will break the apex. Okay. Guys, be delicious, very important to read. Please, guys, be delicious, make things easy for you. Next question, question 2. Which force application is most appropriate for extraction teeth number 36? Rotation force only, or figure 8 forces, or buccal lingual force is stronger toward the buccal, or buccal lingual force is stronger toward lingual? Based, the guys on Be Delicious, you will know the right answer.
Alhamdulillah.
Question 2 is or a strong force or a strong buccal and lingual forces. Okay, guys, if you still have any doubt about anything, we can go back again to revise. Okay, guys? So, guys, answer A, B, C, D, and E. Which one? Guys, what exactly? Because I see you have confusion. And Be Delicious, guys, we just give it to you this week, I believe. Guys, Be Delicious, guys, is it more toward lingual or more toward the buccal? Please, guys, based on Be Delicious, not based on, because otherwise, I will open my Be Delicious now. Question 2. Toward the buccal, toward lingual. Okay, guys, because we're talking about 3-6 and 3-7, you will go more toward lingual because lingual is thinner. Okay, guys, please. D delta. I don't know why you're confused. Okay, question 3. If extraction of 237 is later required, which force application is most appropriate? Again, guys, D delta. Okay, again, guys, D delta. Question 4. For left-handed operator, what is the most ergonomic position to extract tooth number 36? Left-handed. A, B, C, and D. It's a mirror. If the right-handed will be front, it will be in the back and right-hand side. The mirror of this will be Also, the back end will be left end, front of patient to back. D delta, mirror, will be the mirror. On the right hand side will be left hand side, back will be back. So the answer, guys, for question 4, D delta. Very good. Question 5. For right-handed operator, what is the most ergonomic position to extract 2-7? Right-handed. Right will be right. Left will be left. So will be right. Front, yes, front. Because quadrant 1, quadrant 2, quadrant 3, if you are right-handed, it will be right and from front. Quadrant 4, it will be from the back. Right, but from the back. Now it's a mirror for the left. If seizure occur unexpectedly during treatment, which approach best reduces injury risk? B, bravo, clear in instruments and avoid forcible restraint. A 13-year-old boy present after bicycle accident. Guys, wake up, guys. Everyone wake up, please, okay? We're getting into the most important questions. Involving the maxillary incisors. One incisor shows enamel dentin fracture with visible pulp exposure. The fragment was retrieved but has been dry for several hours. Question 1. What is the most appropriate initial radiographic assessment? C. Charlie. Time's up. C. Charlie. Periapical radiographs with different horizontal and vertical angulation. Very good. Next question. I love this way. This is gonna make you guys to save your time in exam, to manage your time in exam. If conventional 2D imaging is inconclusive and the complex then to other injury suspected, what is the most appropriate next imaging step? Answer is C, Charlie. Consider CBCT. Question 3. The fracture involves enamel and dentin with pulp exposure. How is this classified? By the way, guys, for all the candidates, I know some of you actually, because in Zoom and the Facebook together, I know most of you sitting for March exam. But for all the candidates guys for September exam, we're gonna start the course straight away after we finish next week. So be ready. Don't think, guys, for September candidates, they are far from the exam. You are not. So please, guys, be ready, okay? Because we're gonna start very soon. Answer is complicated crown fracture. Be bravo. Giving pinpoint exposure in a recently traumatized permanent incisor. What's the preferred? Okay, the preferred vitality preserving management. Is it direct pulpic capping with calcium hydroxide? The keyword direct pulpic capping. Immediate root canal treatment. Partial pulpotomy, specific pulpotomy with MTA. Or extraction observation. Or RCT, which one? Like RCT. Answer, guys, is C, Charlie, partial pulpotomy. We mentioned A, we don't like in this case that much. Very good. Question 5. The fragment is complete but dehydrated. What is the most appropriate restorative approach? Fragment is complete but dehydrated. Answer, guys, is provided here, right? You wish that if this happened in exam, true? I know. So what is the answer? So now the idea behind this is, the idea behind it, yes, you wish if this happened in exam, right? Yes. The idea behind it, even the key word, or actually the guidelines, is the portion, is it complete or incomplete? If the portion is complete, even dehydrated, you still can attach it. Hydrate and attach it. But if the portion is incomplete, you cannot, and then you need to do, you need to restore the tooth. Everyone wish, right? You see, I'm very nice. Next question, a 45-year-old. Question 1. Which force application is the most appropriate? Extraction 2.5. We know it by now. So don't do mistakes again. A alpha or B bravo? B bravo. Buccal and palatal forces with strong forceps. Very good. B bravo. Question 2. Which force application is the most appropriate for extraction tooth number 16? Same things like 1.5, like 2.5. A stronger forces toward the buccal, which is B bravo. Question 3. Which force application is most appropriate for extracting tooth 3.5? Buccal and lingual forces, but which one is stronger? Toward the buccal. So the answer is C, Charlie. Question 4. Which force application is the most appropriate for extracting tooth number 3.6? Buccal lingual forces, the strongest forces toward the lingual. D delta. Given the patient has epilepsy, how will you minimize the risk of triggering seizure during the procedure? 30 seconds. 30 seconds has gone. A alpha, avoid the light of dental unit directly facing the patient's eye. Patient eyes, A alpha. Question 1. Which force application is the most appropriate for extracting tooth 3.7? As we mentioned, buccal lingual forces with stronger forces toward the lingual than the buccal. For a right-handed operator, what is the most ergonomic position to extract tooth number 16? Right and front. Easy. Question 3. Left-hand operator for 3.6. A little bit confusing 3.6 for left-handed. Need you to think a little bit. Try to think a little bit, guys, for this. Again, right-handed will be on the right. Left-handed will be the left. So choose option with the left. Now, it's a mirror. 3-6 is front. For right-handed, which actually for right or left, we're both front. So guys, 3-6 right now will be which one? Left and the front, like B, or left and back, which is D? Which one? Very good, left and back. Okay? D delta. Question 4, for left-hand operator, what is the most ergonomic position to extract tooth number 4-6? Left straight away. Which option has a left? B and D. Left and front or left and back? If 3-6 is from the back, so 4-6 should be from front. Be bravo. Right, guys? So yes. Any one of you guys left-handed? Who's guys left-handed? Very hard, the left-handed. Okay. Now, both-handed. That's a good one. Okay, guys, now. Tomorrow, Tuesday. Guys, can you please guys give me, can I grab your attention for a second? Yes? No? Okay. Now, tomorrow, we will have a session again. At 7. I keep uploading Bit Delicious for you. The most important thing at this stage right now is the Bit Delicious, because I have changed the system. Plus, these types of questions. Don't read books at this stage. Not too many, because we already had enough. We already had lots of books. Because if you go to read more books at this stage right now, you will not have time to revise the books. Yes, be delicious, be the bites and diamond. You're right, Dr. Lev. Okay? Dr. G. Land, why not diet palpicapin? It's mentioned in Be Delicious. Diet palpicapin, it should be, if it's very recent and should be really very small, and the area has been protected. In this case, you can do diet palpicapin. It still can be an option, but not always. Okay. One very important thing. Please, guys, if you have any confusion at this stage for any questions, don't spend that much time on it. Guys, am I clear about this? If there is a question making you crazy and you cannot find the right answer out of this question, please, guys, don't spend that much time on it. Why this? Okay? Why this? Because it's gonna waste your time. I prefer at this stage you revise 100 questions in 30 minutes or an hour rather than to waste your time for 2 hours, 3 hours, sometimes for the whole day to find only answer for one question. Am I right, guys? Now, let's now discuss very important topic. Guys, are you ready now, guys, to discuss very important topic? Okay, let me just fix this one and then discuss now very important topic, guys, for you. Question 5, we still have question 5, question 6. Question 5, guys, quickly. You know what will I discuss right now with you, guys? Imagine, guys, what will I discuss now with you? Keep this one here again. Always ready. I'm very happy to read this. Facebook questions. We can go through Facebook question. Dr. Gillian is very small. If it is just very small. And we see we don't like it in the first instance, Dr. Gillian. We like partial pulpotomy at these stages. If it's very small and sterile, mostly if under rubber dam, like there is no contamination of the saliva to the pulp. Time management is very important, yeah, but no, this is not the one. Guys, by the way, before I start to explain about the next topic, which is really very important topic, really very important, and I'm sure every one of you has a confusion in this part. This topic, that's why. Okay, no, not extraction technique. You don't know, guys? You don't know, guys, which topic? By the way, can you tell me first, is this what we have done today? Was something good for you or not? Yeah, I will see what's going on with this radiation. Don't worry, don't worry. Suture, I think already it's enough because I gave bidobites and bidiretion suture. Will be enough. TMJ already enough because we have discussed already questions about it. We discussed the concept about it. You have the best bidobites, you have the best bidiricious. Enough. Bleaching, not really. We already have bidelicious in it. We have bidobites. We discussed lots of questions. Enough. Okay. Guys, do you really guys need a session for bleaching? Or the bidelicious enough? Do you really need guys anything anymore for TMJ? Or bidelicious and bidobites enough? No, right? Enough? Bidelicious is enough, right? Guys, we covered nicely all these topics, guys, already in bidelicious and bidobites and stuff. Bleaching is okay. Dr. Shelpa, did you see the bleaching, Dr. Shelpa? Have you seen the bleaching? Have you seen the delicious, Dr. Shelpa? I will only wait for your answer. Otherwise, I will get the bleaching now, the bleaching delicious, and tell me which one you want to still have some information. Yes, this is the last 2 days, doctor. Look at this, Dr. Senai. Doctor, please do last make quick revision for important points which you think about. This is normally the last 2 sessions. My last 2 sessions, I just forget about what we have discussed in the past. I only focus on the only thing important for the exam. Like this is the only thing, only. Because that's the only things I need you to revise. Only I do this in the last 2 days. Which is gonna be next week. Okay. Guys, what we're gonna discuss right now is vital pulp therapy. I know everyone has a confusion, right, guys, about vital pulp therapy. So now we're going to discuss vital pulp therapy. By the way, before I discuss vital pulp therapy, just answer, guys, for this question, question 5. For right-handed operator, what is the most ergonomic position? For 2-7, it's front and right and front. Which force application is most appropriate for extraction tools number 4-6? We already mentioned this one, buccal and lingual, more toward lingual. Now, there was a question about radiation. I'm not sure what's going on in that question. And then we start with, so, and then straight away, we'll start with vital pulp therapy. Guys, which question, guys, can we stay me? Guys, which question, guys, for the one you mentioned about radiation? Scenario 4, question 5. Scenario 4, question 5. So let's count from here. I think that should be the one. Question 5. This one. Given patient medical history before extraction of irritated mandible, which complication is a primary concern related to radiotherapy? Medication related, no, definitely. Osteoradionecrosis, yes, B, bravo. Our size, no, reversible, both of B, bravo. Osteoradionecrosis, no medication, because the question asked about radiotherapy. Easy one. Okay? Okay, now.
நல்ல குட்டியே என்ன ஆச்சு பிள்ளைக்கு
Let's say you have central, that's not a central incisor. That's like a cone. Okay, guys, you have upper central incisor for a child. This child is 4 year old. He got a trauma, and then there is a fracture for enamel only, enamel, not the pulp. What do you think the treatment will be? Just to compose the restoration. Am I right? Just compose illustration. If enamel, only small enamel, you can smooth it out. If enamel and dentin, just restore, or based on how big it is. Okay? Small one, just smooth it, round it. If it's big one, just compose it. Okay. Let's say the trauma was really big until this level with pulp exposure. What will you do? If there's a pulp exposure, what will you do? Are you going to do diet pulp capping? Are you going to do in diet pulp capping? Are you going to do pulpotomy? And which material will you use? Calcium hydroxide or MTA? Guys, I already shared a very good article for the recent update. So in this case, we don't prefer diet pulpotomy. We don't prefer in diet pulpotomy. We're going to use, based on the recent knowledge information, civic pulpotomy, and we may prefer at this stage MTA. Okay? Clear now, guys? Very good. Let's say this tooth, after some time, became irresponsive. After a week, 2 weeks, irresponsive. What you need to do after this? Patient is 4 years old. The tooth is irresponsive. Negative sensibility test. After 2 weeks, what are you going to do? You did the treatment, you did partial pulpotomy, civic pulpotomy with MTA, and fine, and then after 2 weeks, negative to sensibility test. Everyone say pulpectomy. Sorry, that's not right answer. Guys, please be careful. We cannot decide on necrosis after only 2 weeks from one sign only. Okay, I see everyone quickly pushed toward pulpectomy. No. Okay guys, look at this. If we have only one sign or symptoms like this is not enough, because maybe the tooth is still recovering. I need at least one sign and one symptoms. What does it mean? I need to see a sign of infection, for example, maybe a swelling here on the gums, and then plus negative sensibility test. So when I see gum swelling plus negative sensibility test, now I may confirm with pulp necrosis or even infection. So at least we need one sign and one symptom. Let's say after 2 weeks, discoloration only happened. Only discoloration. are you going to say this is necrosis and then you do pulpectomy? The answer is not. So in this case, what we need to do? What is the best? To take X-ray. What is the best? To wait or to take X-ray? Take X-ray to find out what's going on. I will take X-ray. Okay, very good. Let's say there was necrosis. So now there is necrosis. What is your treatment in this case? Like negative bulb therapy, sorry, negative sensibility test, discoloration, plus swelling, pain, all the stuff. What is the most appropriate management here? Pulpectomy. What do we use, guys, for pulpectomy? What do you use, guys, for pulpectomy? Zinc cytogenol. Okay, very good. This was for a 4-year-old child. We're talking about vital pulp therapy, not trauma cases. Now, the same tooth, but the patient is an adult. Adult. Let's say from 9 to 12-year-old. Sorry, guys. Actually, that's okay. By the way, guys, pulpotomy in deciduous teeth, we like to do coronal pulpotomy more than civic pulpotomy in deciduous teeth, because I have seen some, if you say partial pulpotomy, guys, okay? If you have mentioned this, which one we do for deciduous teeth? Partial pulpotomy or complete pulpotomy? Because I remember even you made me to say civic pulpotomy as well. And deciduous teeth, guys, which one we like it more? Complete or partial? Deciduous, baby. Complete pulpotomy, guys, okay? We prefer complete pulpotomy. Okay, not partial, please, okay? There is a file. I have shared it with you. It's a perfect file. I give you all recommendation, which one you need to do, which one is not. Please, guys, look at this file. It really will help you. Now, the child is 9-year-old to 12. He just got the enamel broke. What is the treatment? Restoration. Seal it back if complete portion. Now the patient has pinpoint exposure. What's the treatment? Civic pulpotomy, partial pulpotomy with MTA. Now, patient came to your clinic after 3 days from the trauma. What is the treatment? Again, pinpoint exposure, complicated crown fracture. What is the treatment after 3 days? Thank you very much. Complete pulpotomy. Why? Because when, guys, please, guys, learn this concept. Very interesting concept. Because there is saliva here. Look, guys, at this saliva. Saliva, saliva, saliva. Saliva was what? Saliva with bacteria. Look at the bacteria. So what's happening is, when there is pulp exposure, the saliva and bacteria will attack the exposed pulp. And if it does attack the exposed pulp for the first day, you just only remove 1 millimeter of the contaminated exposed pulp with saliva and the bacteria. What about 2 days? Go a little bit deeper. 3 days, go a little bit deeper. You will find, I would say, to make it easy for you, every day with 1 millimeter. First day, remove 2 millimeter. Second day, remove 3 millimeter. For third day, remove 4 millimeter. Like every day, increase 1 millimeter. You will find yourself end up with full pulpotomy. Total pulpotomy. Clear? Okay. Now, pulp exposure, after you did the treatment, you ended up with necrosis. What you need to do after this? What are you going to use now, guys? Necrosis. What you need to do? Pulpectomy. How we do pulpectomy? Are we going to use MTA or calcium hydroxide? As I said, normally now they go more toward MTA. Necrosis. Necrosis. Patient between 9 to 12-year-old. 9 to 12. Patient is between 9 to 12. No. If the patient is between 9 to 12, we still need to do pulpotomy. Okay, guys? If the patient is still between 9 to 12, we still need to do pulpotomy. Why this? Because at 9 to 12, you will find one of these. What you will find is either immature apex, because the tooth is erupted at 7-year-old, 7 to 8. You need at least 3 years for root completion. So 3 plus 8 means we're talking about 11-year-old. So the root may actually be complete or closed, can be closed at 10 to 11-year-old. But do you think the amount of enamel and dentin and cementum, especially cementum dentin, do you think the amount of dentin and cementum is strong enough to do RCT? I doubt. That's why we need to fill it in with either MTA or calcium hydroxide to ensure you get a good thickness of cementum and dentin. How we call this process, guys? How we call this process? We call it as apexification. What's the difference between apexification and apexogenesis? Now we need to know the difference between apexification and apexogenesis. Okay. Let me remove all of this first. So now we have two important terms. Apexogenesis and apexolocation. Apexolocation what? Apexification. Apexogenesis, what does it mean? Pulp is vital. Use a medicine, MTA or calcium hydroxide. Why? Because when the pulp is still vital, the undifferentiated mesenchymal cell is still vital inside the pulp. So the irritation, because MTA is very irritant, is highly alkaline. Calcium hydroxide is very irritant, is highly alkaline. pH is too high, above 12. In this case, what's gonna happen is the undifferentiated mesenchymal cells inside the pulp will go irritated and stimulated by any of this medicine to build up cementum and dentin. First, to change to be odontoplast or cementoplast, cementosite, cementoplast, odontosite, odontoplast, and to build up cementum and dentin, which is a condition apexogenesis. What does it mean? Pulp is vital, undifferentiated mesenchymal cells inside the pulp will deposit dentin and cementum. What about apexification? Something similar, but the pulp is dead, and then we rely on undifferentiated mesenchymal cells in the outside portion of the root, like the tissues around the roots, not the pulp, because the pulp is dead. And that's why the root will develop back again. And I wanted this action when the child is between 9 to 12 years old and the tooth, either the root is immature or the enamel, the dentin and cementum is thin and not strong enough. Guys, am I clear about this so far? Now, guys, you know the difference between apexogenesis and apexification, right? Good. And what is the right treatment for anterior teeth? Now, let's talk about posterior teeth. Back again to the child. This is a molar in a child. The root is thin, but this one thick. The paw bones are high. Now, if you have only caries on that enamel, what you're going to do? And the patient age between 5 to 9 year old, or maybe 3 to 9 year old. 3. What are you going to do? Restoration. The caries is actually still here in the spirit, but there is broken marginal ridge. What are you going to do? What are you going to do? The patient is aged between 3 to 9, deciduous tooth, deciduous molar. The minimum things you can do here right now is pulpotomy. It can be either pulpotomy or pulpectomy. Now, how do I know there is pulp exposure? Because the marginal ridge is broken. Which method we gonna use for this baby tooth? Again, let's say MTA. . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . What are we going to do? Partial pulpotomy or total pulpotomy? Total pulpotomy. Total pulpotomy. The same patient, I have decided to do pulpotomy, but every time I try to stop bleeding, bleeding never stop. So in this case, guys, what we gotta do? We're going to use, we're going to do pulpectomy. Okay? So now, first, you decide to do pulpotomy. You're going to remove all the pulp. Then place ferric sulfate, 15.5%. If bleeding doesn't stop, in this case, you shift from total pulpotomy with ferric sulfate to pulpectomy with MTA. What if at any stage the patient has radiolucency? Can do pulpotomy with ferric sulfate? No. What if there is root resorption? And maybe not just 1/3, more than 1/3. In this case, can I do pulpotomy or pulpectomy? No, I need to do extraction. What if there's furcation involvement? Can I do pulpotomy or pulpectomy? No, I need to do extraction. Is that guys clear so far for deciduous teeth vital pulp therapy? Any question, guys? Okay, I will repeat this one again. Just conclude all of this again. This is not a tooth. Now, the patient age between 3 to 8-year-old or to 9-year-old. Because after this, we do extraction. After none, we extract anyway. Before this, two hard caries to happen. Anything happen. Now, there is only caries. Restore with small one, restore with resin modified GIC or the high viscosity GIC. It's a little bit big. Use composite. Major ridge completely broken. Do pulpotomy with ferric sulfate, 15.5%. Pulpotomy, not the case here. A reverse pulpitis, necrosis, infection. Do pulpectomy. Using what? Zinc cydigenol. Because the material should be resorbable material. No, actually, there is more than 1/3 root resorption. There is furcation involvement. There is tooth is loose. There is severe infection. Patient has cardiac condition, heart disease. There is a high risk of infective endocarditis. Pulpotomy will not work. Pulpectomy will not work. Only extraction will work. Patient after 9-year-old extraction. And most, if the patient between 3 to 8-year-old and you decide on extraction for any of that reason, you need to do space maintenance. If the patient more than 8-year-old, like 9 above, you don't need for space maintenance. I hope guys is clear right now. Let's say the same thing, but this is an adult tooth. adult molar. Again, small fracture, composite. Complicated fracture, just pinpoint, do civic pulpotomy with MTA. Necrosis, do RCT. What if necrosis happen while the patient, while the root incomplete root, immature roots. Necrosis has happened. In this case, we still can do apexification or extraction. If this is upper 6 or lower 6 and the patient age about 12, 11 to 12, extraction will be a good option. But again, it's much better to consult with orthodontist about this case. Otherwise, extraction. Guys, exactly so far to everyone. Guys, that guys key to everyone? Yes? Did you guys get good information today? Good information, yes, multidisciplinary approach. I know, guys, there are lots of people fasting right now and you're tired. You have been eating, guys, since morning and got plenty of information. So I think that's enough for now. I will be working all the night and more bit delicious to make things easy for you. Okay, guys, and then we discuss more questions as well. And I will upload more question bank as well. Okay, this session, guys, may be recorded, especially on Zoom, also on Facebook. Right, so that's enough for now. I know, Dr. Fatima, because you are fasting, brain is not brain. So that's enough for today. Please, guys, wait for me for tonight. I will add more bit delicious all the nights. I keep work on them and also questions as well. Thank you very much, you guys. Please, you can. Dr. Anshel says, please, Dr. What? Yes, Dr. Anshel. What do you say? Thank you, Dr. Bill. Thank you very much. I think I missed Dr. Please just repeat permanent molar. Okay, for permanent molar, if it's just the enamel, restore it with composite. Enamel and dentin, you can be composite or sandwich technique. If there is a pinpoint pulp exposure, and this is happening while you're doing excavation on rubber dam, do direct pulpic capping. And then if it's really more deeper and maybe because of trauma, you can do pulpotomy using MTA. And then if it's deep and necrosis in it, depends on the age and the root maturity. If it's more than 2/3 of the root has been already completed, most probably you can do apexification. It may work, but still you need multidisciplinary approach with orthodontist to decide on extraction or to keep the roots, to keep the tooth and to perform apexification. Okay, thank you very much. Thank you very much, guys. Have a great night, every one of you. Immunocompromised patient and adult tooth pulp therapy. Yes, I do extraction for baby teeth. Adult depends on which condition. Depends on which condition, but not every single patient with immunocompromised or every single patient with infective endocarditis, for example, or risk of infective endocarditis. For adult, we need to extract. But yes, some cases when really it's very, very high risk, we extract better. Thank you very much, you guys. Have a great night, every one of you. Thank you, guys. See, tonight I'll be working more with delicious, as I mentioned. Thank you very much, you guys. Thank you. Bye-bye. Thank you very much, you guys. Thank you.